Hello, and welcome to a brand new episode of Defeat Obesity. Today's episode is even more interesting because it comes to obesity and women. So, to discuss this, we have Dr. K M Swetha, who is a gynecologist at Sammprada Hospital. Hello, Dr. Swetha. Please welcome to the podcast.
Hi, Megha.
Hi.
Hello, audience. I would like to thank everyone for getting me here to have a nice talk. I would like to enjoy the podcast myself.
So, firstly, yes, we are talking about obesity. So, women obesity. And I'm sure you're seeing a lot of patients and obesity triggers from your puberty, fertility, perimenopause, menopause. How are we going to address it? That's a big rise in the society now.
Yeah, a very serious problem which we encounter in every stage of womanhood. More so, I would like to correct on that. It doesn't start just from puberty. It starts probably at the womb stage, when the baby is growing in the womb. Okay. So there's also a theory. It is a very interesting theory. It actually starts from the grandmother of the girl child. So I think most of us would have the knowledge that eggs which develop in the ovaries, they develop very as early as they are when they are in the womb of the mother. Okay, we don't have fresh eggs coming up once the baby is out and thing. It's only the regression of the eggs which actually occurs. So when the grandmother of the girl child is pregnant with the mother, okay, the eggs which would form the grandchild is already growing in the mother inside the grandmother.
Oh, wow.
Okay, so the influence, so it is over a generation which this metabolic I would say a syndrome, because it is not one symptom which occurs in PCOS or in obesity or in thing. Especially with obesity and PCOS, it starts from there. So the lifestyle of the grandmother, the eating habits of the grandmother, the obesity in the grandmother has influenced the second generation which comes out from the mother of that child.
Wow.
Okay, so there's a theory, and I think it is relatively very understandable even for a common man to understand this, because our eggs already are formed when we are in the womb.
Wow. Quite
Okay,
interesting.
so around maybe around 6 months it is around 5 to 6 million, but when the baby delivers, it comes up to 1 to 2 million. And only out of the 1 to 2 million it undergoes regression, and only 400 of our eggs becomes fertile, which are capable of developing a baby. Okay, so in a lifetime maybe one or two or going up to three eggs become pregnant, the other eggs, I mean, fertilize and form a baby, the other eggs regress, and finally we reach menopause when the number of eggs count reduces to minimum.
Okay.
That is how our female reproductive system goes. So the reproductive period will start uh, from menarche, that is the time when you start getting your cycles, up till 45 years. Okay, that is the average. That is how our influence of metabolic changes start occurring as early as, I would say, from the generation of our mothers.
Genes, is it? Okay. And doctor, obesity also leads to PCOS, PCOD, thyroid in women.
Yes. So now I think the younger generation are more suffering from PCOS, what we call as polycystic ovarian disease, and now the recent one is it's polyendocrine metabolic disorder, ovarian dysfunction. So they have recognized it is not just the ovaries which cause the problem; it is an overall body which reacts to this kind of dysregulation. I would say dysregulation of hormones. So in all this, that is obesity, PCOS, and other cofactors along with these two, the main would be insulin resistance, I would say. Okay, it starts with insulin resistance and hyperinsulinemia. That is, insulin resistance is there are receptors where the glucose has to be taken in by the tissues. Okay, So, and there is a regulation in the body through insulin to stop that uptake, excessive uptake, I would say.
Okay.
So, when this regulation which has to happen, this causes resistance. This will prevent it from regulating.
Okay.
So, as obesity, that is the body weight, starts increasing, the insulin resistance also increases. So, the insulin, which, like everyone knows, it reduces the blood sugars. That insulin, which has the capability of reducing the blood sugars, doesn't do its job because of the receptor problem. But there is insulin. The body has insulin. The body is releasing insulin, but that is not acting at the tissue level.
Okay.
So that's preventing that that excessive uptake is not regulated at.
And is obesity and pregnancy related, fertility, all these are correlated?
Very much related. We would, I think, first there's lots to speak about obesity and infertility, and coming to pregnancy per se. Um, Many ask why it is not seen before. Our grandmothers and mothers didn't experience what is called as PCOS. This is a new terminology. And they seek advice like give us some tablets so that we're out of it.
Correct.
Okay. So more so it becomes a diagnosis by scan. They would have done a scan for some other reason, and the final diagnosis writes bilateral polycystic ovarian disease. That will trigger the patient to, now we have ChatGPT to Google, we have Google to think, we have doctors everywhere, I would say. So half an information, they are stressed about it. So what happens, first thing it will show us is, it will show infertility, it will show all the problems possible, diabetes, hypertension, everything coming up. And so the patients, though they don't have any other menstrual problems, they'll come with just the scan showing PCOS. You address them, what is your problem, why you, what brought you to a doctor, they'll say, doctor, I have PCOS. Okay, so then we'll have to elicit what kind of symptoms are they facing. Are they really having problems with PCOS? Not all PCOSs have problems. Not all PCOSs have problems in conceiving. Not all PCOSs develop complications in pregnancy. So why some don't develop, it again becomes a lifestyle problem. So how their lifestyle is changed, how do they inculcate their lifestyle, that becomes a more important aspect of PCOS.
So when it comes to you, especially women's health, I'm sure obesity is affecting, for example, like maybe a joint pain and increasing risk in the cancer care also. Obesity is increasing the chances of cancer as well. But when it comes to women's health, what do you see the most, doctor? What is the kind of patients you get with obese? Are they working? Are they homemakers? Are they students? I'm sure these days a lot of working professionals have no time limit for eating, and the portions that they eat, a lot of sugar intake. Yes, we know there is a calorie count, but I don't know how many people are following it.
So I would say it starts very early nowadays, not like before where we see only obesity in the later part of their lifestyle. Mainly because we usually nowadays we pick up PCOS, or it comes into surface during their children in their 12th standard, or as early as 11th, 12th standard. Why? Again, till school they are forced to do some physical activity. They are involved into some physical activity. School also gives them some PT period, games period. When they enter into the college phase and they are into that competitive phase of studying and getting into some professional course or some course, they are bound to their books. They're either sitting and studying, hardly any physical activities from morning till night. The competition is that high. I think that competition itself has increased the incidence of obesity, as well as unmasking what was before just PCOS not causing any problems. Suddenly they'll come up with many problems. So it starts as early as 16, 17 years of age for us. Okay, and we see many patients coming to us in that period of time. Okay. And of course, later on, those people who, nowadays the marriage age also has increased. So those who come later on, they have multiple problems. PCOS or obesity can be one of them. Okay. Definitely a contributor to increase in the incidence of infertility.
And also, post-delivery, for example, a lot of people don't lose weight naturally. Is it what they've eaten before, during the 9 months of pregnancy or before, and the obesity, which people are unable to lose weight even after delivery, and the process is long.
Yes, definitely the process is long, but we all advise them. Well, I think all gynecologists now advise them to get back to their normal physical work by 6 weeks postpartum. Okay, even if it is a C-section. 6 weeks is what your body requires for the major tissue healing. Of course, the inner tissue healing will take some time, but starting off general like walks, brisk walks can be started as early as 6 weeks. Maybe our Indian culture, we are more prone to give extra nutrition, extra carbs are part of our staple diet probably. That is why we tend to gain quite a bit of weight during pregnancy and thing. And of course, I think you have to eat for two. You have to cater to two people now.
Is that a myth?
Yes, definitely a myth.
So
it's
we eat
not
for
about
one.
yes, we eat for one. Yes, the calorie requirement is more. Definitely during pregnancy, it is almost plus 300 from a normal adult, and during lactation, that is during the feeding period, it is around 500 per extra. Okay. But that calories from where it is coming, that is the most important part of it. What kind of proteins you're eating, what kind of food you're taking, that becomes an important aspect. But since that's what, especially in our, I think South Indian, we eat more of carbs compared to North Indian people. They are more into vegetables and things. Our South Indian, of course, we have vegetables in our diet, but still we have more of carbs. I think so. A balanced diet, including more of proteins and minerals, vitamins, everything, rather than just putting in on eating more, would definitely be a contributing factor.
And is PCOS and PCOD reversible?
I would not say it is reversible, but it can definitely be kept in check. Okay. So, I think PCOS people know their body very well. Okay, you lose just about few kgs of weight, their body comes back to regulation. And usually our patients will come back saying, I was doing this physical activity and everything was fine, and suddenly now I'm not able to do over the past 3-4 months, and I'm back with my old complaints. And I had PCOS before. They'll give me the diagnosis. There is nothing new to diagnose for them. Okay, most of the time, I would say. Now we have educated, most of them are educated, and even young girls will start, Googling and searching for their answers. Symptoms. Sometimes they come with big thing. Do I have cancer? I'm bleeding so heavily. They would have definitely Googled. I think accessible of technology is so high.
Yeah. So Google is not the doctor.
Yes, definitely not the doctor. Definitely not the doctor, and it would cause more confusions and sleepless nights.
Yeah, it's mostly sleepless nights. It never gives you an answer which you like, yes, shit, I'm happy now, I'm content. It never gives.
Yes, I think any problem, I think we should consult the doctor immediately and clear up what they really want to, clear up.
Doctor, these days Instagram is also the new doctor. Like how we have Google, Instagram is also the new. Easily accessible. Everybody are doctors, whether certified, uncertified, yes. What is one thing you tell women, please don't follow this. Don't follow blindly. Come to us.
I think crash diet. Okay, totally crash diet, and I won't eat that, I won't eat this, I will only drink detoxifying water. I will drink low on carbohydrates, I'm not going to eat any fruits. So see, fruits is nothing but again sucrose, but there are some other also vitamins and minerals which are never found in any other food rather than fruits and things. Yes, you have to have them in a limit. Everything needs a limit. Everything needs a cutoff. So I think that we should be thinking. Definitely a no for total crash diet and losing weight in 10 days. I will lose 20 kgs. That was more harmful rather than any beneficial. And you will again gain weight within the next 1 week or 20 days if you start coming back to your regular thing. So I think sustainable, which is easily sustainable, and also part of, and we always advise dietitians or we doctors advise the patients to stick to your staple diet, but change it a little bit. Portion control, and include some other satiety, high proteins rather, I would say high protein diet, rather than increasing the quantity or increasing eating only the carbs. Reduce the carbs, increase the protein aspect of it, so that will give you good energy also, and plus give you give a sustained way of managing your.
And do you also suggest good amount of exercise too?
Definitely a good amount of exercise, but equivalent to that, you have to take the proper nutrition. You should not land up with malnutrition symptoms. Okay, because even I've seen some people who don't even take a drop of oil. I'm not eating oil, doctor, but you should understand, even that oil content or the fat content which gives from the oil is good for your skin. It hydrates your skin, that supples your inner organs. So definitely a no to such diet.
And one final question, doctor. Does obesity leads to irregular periods?
Yes, it could be part and parcel of PCOS, because obesity will unmask the underlying PCOS condition, which can lead to irregularities, again because of insulin resistance increase. So it's like a vicious cycle. Okay, so either obesity would have triggered PCOS, which has led to irregular cycles, which causes irregular cycles, and the irregular cycles will lead to excessive of fat accumulation because of the unregulated hormones which are released. Okay, so again it becomes, again you tend to lose weight, but it is not impossible for them to regulate the weight. I would say, rather than setting a target of saying all patients should lose 5 to 10%, 10 kgs of weight, I would say lose 5 to 10% of your body weight. Okay, 60 might not be okay for a person who's short.
Correct.
Their BMI has to be maintained below 24 now. The Indian standards have reduced it from 25 to 24 now. Okay, so reduce 5 to 10%. If you feel you're obese, your BMI is coming high, reduce it by 5 to 10% and keep your BMI in the range. That will give you a more sustained health benefits, rather than just losing weight abruptly.
Thank you so much, Dr. Swetha. I hope it was a very insightful session, and thanks to Dr. Swetha for sharing lights on women, healthcare, and obesity. Thank you.
Every small change begins with awareness. Stay tuned for more expert insights on obesity and better health.